For giving a bath, let's go over the step-by-step process. If at all possible, bathe the patient near a sink. Fill the basin halfway with warm water that feels slightly hot to the touch, about 120 degrees Fahrenheit. The water will cool to a comfortable temperature of 110 to 115 degrees by the time you're ready to use it. Also keep in mind the safety of you and your loved one during the bath. Assuming the patient is using a hospital bed, be sure to raise or lower the level of the bed to a position that's comfortable for you. This prevents strain on your back, arms, and legs. You'll also want to use the side rails to ensure the patient can't accidentally roll off the bed. Position the patient in bed in a semi-sitting position, either by raising the hospital bed to a 45-degree angle or propping the patient up with pillows or a foam wedge. Now, to make a bath mitt from a washcloth, place your hand in the center of the washcloth. Fold each side of the washcloth across the palm of the hand. Now, fold the top of the cloth over the palm and tuck it under the edge. Now you're ready to wash the face, starting with the eyes. Dip the washcloth into plain water without using soap, which can irritate the eyes. Clean the eyes by wiping from the inner corner to the outer area. Use a different part of the washcloth to clean each eye. Gently finish washing the rest of the face using plain water. Now it's time to use soap to wash the neck and behind the ears. Use bar or liquid soap to lather the washcloth, or add a no-rinse soap to the water. Do not leave the bar of soap in the basin, and don't put regular liquid soap in the water unless you use another basin of water for rinsing. If you use bar or liquid soap, be sure to rinse well. Then pat the washed areas dry with a towel. At this time, check the eyes for any sign of drainage or redness that may indicate irritation or infection. Check for yellow discoloration of the eye. Note any changes in the patient's ability to track your movements with their eyes. The pupils should generally be equal in size and react to bright light by becoming smaller. Notify the doctor or nurse immediately, or if one eye appears to be dilated and fixed in size. Also, any drainage from the ear should be reported. When washing the neck, look for changes in the size of the lymph nodes in the neck. Also notice the facial muscles. Does the patient move both sides of the face in an even way, or does one side droop? Shaving is also a part of regular hygiene for both men and women. To prevent cuts or electrical hazards, use a battery-operated electric razor and follow the manufacturer's instructions. Begin the rest of the bath by lowering the head of the bed or repositioning the patient comfortably. Unfasten the patient's gown so it's ready to be removed. Next, cover the patient with a top sheet and a clean cotton bath blanket. Reach under the bath blanket and pull out the top sheet so the patient is covered only by the bath blanket. While holding up the bath blanket as a drape to avoid exposing the patient, the caregiver can remove the patient's gown. Place the wash basin on a towel on the bed and dip the patient's hand in the water. Use the washcloth to wash the hand closest to you. Make sure you clean between the fingers and under the fingernails. Using long, smooth strokes, wash from the wrist to the upper arm. Rinse and pat dry the patient's arms and hands. Repeat the same procedure to clean the opposite hand and arm. Apply lotion to each hand and massage with short upward strokes starting at the fingertips. Stroke each hand several times from the fingers to the wrist. Then massage the arms with long top of the arm. Remove any excess lotion with a towel or tissue. Afterwards, apply deodorant. Note any stiffness, limitation in movement, or pain in the arm. Also note any, especially if it's difficult to extend the fingers, or if the patient forms a permanent fist with the thumb tucked across the palm. Any redness or sores. Check under the arms for hard lumps, rashes, or redness. Now it's time to change down the bath blanket and wash the chest and stomach. Carefully clean the patient's navel. If necessary, rinse the chest and stomach with a washcloth. Then dry the areas well and apply lotion to the skin. Now cover the chest and stomach with the bath towel initially used to drape these areas. Observe the skin for any discoloration, redness, sores, or rashes. Also observe whether the patient is breathing evenly and quietly. Check to see if the patient's stomach seems swollen or painful to touch. Report any changes to the nurse or doctor. Now check the color of the patient's lips and fingernails. A bluish discoloration may indicate the patient is not getting enough oxygen. Some patients, however, develop a bluish color when they're chilled, so after the bath, check to see if the color change persists once the patient's body temperature is warmed with blankets.